Welcome to this explainer. If you've just been handed a high cholesterol diagnosis, you're probably feeling a mix of confusion, concern, or maybe even a little bit of guilt. Well, take a deep breath because you are in exactly the right place. Today, we're going to demystify this totally invisible condition together. We're building a comforting roadmap to health. Because once you actually understand the science of what's going on inside your body, you get the power back. You gain the ability to take absolute control of this diagnosis. So let's dive right in. Here is our quick roadmap for today. We'll be covering your diagnosis, the transport system, plaque formation, total body impact, causes and genetics, and finally, we'll build your action plan. Let's jump straight into step 1. Section 1. Your diagnosis. Let's look at what cholesterol actually is. Now, I want to share a surprising fact that busts a pretty massive myth right out of the gate. People usually think high cholesterol is purely a result of eating way too many cheeseburgers, right? But actually, cholesterol is this waxy substance that your body absolutely needs. It uses it to build cells and make hormones. And get this, 80% of the cholesterol in your body is produced naturally by your own liver. Just 20% comes directly from the food you eat, mostly from saturated and trans fats. So the really crucial point here is that your body is the main manufacturer. It's not just about what's on your plate. Moving right along to section 2, the transport system, to see how this all connects. Because cholesterol is waxy, kind of fat-like, it can't just float freely around in your watery blood. It needs to be packed into these tiny little vehicles called lipoproteins. When you look at your blood tests, you'll see two main types. First, think of LDL, low-density lipoprotein, as a massive fleet of delivery trucks. Their whole job is to drop off cholesterol cargo from your liver to your body's tissues. We call this the bad cholesterol, because when you have way too many of these delivery trucks on the road, they drop off excess cargo and it just builds up in your arteries. But on the flip side, HDL, high-density lipoprotein, acts as your cleanup crew. These guys are the good cholesterol. They haul that excess cargo away from your tissues, taking it straight back to the liver to be broken down and trashed. So the ultimate goal? You want fewer bad delivery trucks and a super efficient cleanup crew to protect your heart. That brings us to section 3, plaque formation. What exactly happens when we get a traffic jam in the bloodstream? Let's break down the silent, long-term process of atherosclerosis. Honestly, it's essentially like the gradual rusting and clogging of your internal plumbing. Step 1, those excess LDL delivery trucks literally crash into the super delicate inner lining of your arteries called the endothelium. When they crash, they undergo a chemical process called oxidation, which basically just means they cause damage. Step 2, your immune system senses this damage, panics a bit, and sends in these scavenger cells called phagocytes to clean up the mess. But they end up absorbing that oxidized cholesterol and actually get trapped right there in the artery wall. Step 3, this whole mess triggers inflammation, and a hard fatty plaque forms. Step 4, over the course of many years, these plaques cause your once flexible, healthy arteries to become thick, stiff, and narrow. Let's look at section 4, total body impact. Because as you'll see, this isn't just about your heart. The really important thing to understand here is that atherosclerosis affects your entire circulatory system. Let's look at the major risks. If that plaque narrows the coronary arteries, the ones supplying your heart, you get coronary artery disease. This can cause chest pain, known as angina. Or if a piece of that plaque ruptures and forms a clot, you get a full-blown heart attack, cutting off oxygen and causing permanent damage. But here's the thing. Those exact same clots can happen in the arteries leading up to your brain. That causes a stroke, where brain cells literally begin to die within minutes. Then there's peripheral artery disease, or PAD. This happens when the plaque narrows the arteries in your limbs, usually your legs. It causes something called claudication, which is basically cramping or sharp pain in your calves and thighs when you're just out for a normal walk. In really severe cases, that lack of blood flow can even lead to non-healing sores or tissue death. And we absolutely cannot forget your vital organs. Your kidneys require a massive, rich blood supply to constantly filter waste out of your blood. When those renal arteries get narrowed down by plaque, it leads to ischemia, which is just a medical term for a severe lack of oxygen. Over time, this silent starvation causes totally irreversible damage to the kidneys. If it's left unchecked, it can actually progress to complete kidney failure, meaning you'd need dialysis or even a transplant. It really underscores why keeping those LDL delivery trucks in check is a total body mission. Let's jump into section 5, causes and genetics. Where exactly is this imbalance coming from? I really want to remove any stigma around this right now. Yes, physical inactivity, being overweight, and eating a diet packed with saturated fats definitely play a massive role. But for a lot of people, high cholesterol is quite literally written into their DNA. Take familial hypercholesterolemia, or FH. This is an inherited genetic defect that causes dangerously high LDL levels from the exact day you are born. There's also lipoprotein A, genetic type of bad cholesterol that is an independent risk factor for heart disease, and honestly, it isn't easily changed by lifestyle habits at all. Throw in other medical conditions like diabetes, an underactive thyroid, or even certain medications like steroids or diuretics, and your cholesterol can easily spike. It's a really complex mix, which is exactly why a personalized approach with your doctor is so absolutely vital. Finally, Section 6, your action plan. This is my favorite part because this is where we take the power back. Okay, so how do we actually fix this? How do we clear out that traffic jam, stop the rusting of our pipes, and really protect our heart, brain, and kidneys? Well, the great news is that modern medicine and some simple daily habits offer incredibly effective solutions. Let's start with the medical side, which is especially important if your overall risk is high or if genetics are playing a big role. We have two heavy hitters when it comes to lipid-lowering drugs. First up, statins. You might have heard of rosuvastatin or atorvastatin. These are the frontline, most heavily studied treatments we have. How do they work? They literally block the specific enzyme in your liver that produces cholesterol. High-intensity statins can actually slash your bad LDL by 50% or more. It's incredible. Then we have ezetimibe. While statins tackle the liver, ezetimibe goes after the gut. It reduces the absorption of cholesterol straight from your intestines, stopping it from ever even making it into your bloodstream. A lot of times, doctors will pair these two together for a really powerful 1-2 punch against that bad cholesterol. But remember, medications are always built on a foundation of lifestyle changes. To lower that 20% of cholesterol that actually comes from your diet, you have to starve the supply chain of saturated and trans fats. You're going to want to avoid or at least severely limit things like red meat, full-fat dairy, and butter. And you absolutely want to steer clear of fried foods and heavily processed snacks. Those are loaded with the exact types of fats that your body just immediately turns into those dangerous LDL delivery trucks. Beyond what's on your plate, your daily habits act like your cardiovascular armor. Exercising regularly and losing excess weight naturally improves your overall lipid profile. Limiting alcohol is also a great idea. But I really want to pause and draw your attention to quitting smoking. Smoking is absolutely devastating for a newly diagnosed patient because it actively damages your blood vessels. It makes the inner lining of your arteries sticky and inflamed, which rapidly accelerates the exact plaque buildup we just talked about. Quitting smoking is hands down one of the single most powerful things you can do to stop atherosclerosis right in its tracks. And that brings us to our final takeaway for today's explainer. High cholesterol works silently, but your daily habits speak loud and clear. You might not be able to physically feel that plaque building up in your arteries, but every single time you choose heart-healthy foods, or go for a walk, or take your prescribed medication, you are actively repairing your transport system. You have the roadmap now. You know exactly how those delivery trucks work, and you know how to stop the traffic jam. So my question to you is, what is the very first loud and clear habit you are going to change today to take absolute control of your health?